Taoiseach, as we speak, hundreds of nurses are meeting in Killarney in the middle of a prolonged and ongoing crisis in our hospitals. The health service is on its knees and has been for many years now. Overcrowding on our hospital corridors, waiting lists out of control, staff exhausted and demoralised. Healthcare staff are at their wits' end. They've been crying out for support, but so many feel abandoned and let down by your government's failure to get to grips with the crisis in our healthcare system. Taoiseach, yesterday 704 people were lying on trolleys as they waited for care. Today 712 people lie on trolleys. This was a predictable surge following a bank holiday weekend. In fact, this has happened on each one of the 5 bank holidays that we've had this year, so it could have been predicted and planned for. The factors that sustain the overcrowding crisis are clear. We still don't have enough beds in the system and not enough staff to service those beds. Experts have warned how dangerous this is in terms of patient safety. Add to this the chronic lack of community recovery beds, hundreds of delayed discharges and a crisis in GP provision. This means patients don't get seen when they need to, where they need to, and end up in overcrowded hospitals. Poor planning, poor leadership and a lack of investment have crippled the healthcare system, and it's patients who are left to pay the price. Hard-working staff, demoralised, trying their best day in and day out, are leaving the system in significant numbers. In fact, the INMO has warned today that 3 out of 4 nurses that they surveyed have considered quitting. I think that's an extraordinary, an astonishing figure, Taoiseach. Can I ask what your response is to that? 3 out of 4 nurses surveyed have considered quitting their job. I suppose we might say, any wonder given the pressure they are under, because crisis has become the norm on your watch, the new normal that patients and staff are subjected to every day. People at their most vulnerable are left on trolleys, languishing on waiting lists and often missing crucial care. And this hasn't happened by accident, but because of government failure to sufficiently invest in healthcare capacity and staffing over the last decade. And the response of government has consistently been far too slow, big often on promises and very short on delivery. Curran Ger came on ro flodus an ospedale ohar in Wales, nor atá altrig ober harave crua hana féin I gúnshi harave jacker. Hepper and realtas con anna occur fall gatapa agus shin atá ag crelar na faiba. Taoiseach, persistent and growing hospital overcrowding can be solved, but only with the multi-annual capacity expansion plan, something that Sinn Féin has been calling for some time. It could make a real difference to patients and workers. There are huge challenges, but big change could be made with determination and the will to deliver real and meaningful difference. So, Taoiseach, can I ask you, when will government support and resource hospitals to reach safe staffing levels in the short term? Taoiseach, will the Minister for Health publish a multi-annual capacity plan, including not only bed targets, but detailing how he proposes to deliver the staff needed to tackle overcrowding? Can I ask you again for your response to that INMO survey and the reported finding that 3 out of 4 nurses surveyed had considered quitting their roles? And can I ask you, Taoiseach, how much worse does it have to get before your government gets your act together and gets to grips with what is a very real crisis?
Taoiseach, please.
Thanks very much, Deputy, for raising the important issue of the various challenges that affect our health service. And as somebody who has worked in the health service, worked in the public health service for 7 years, as somebody who served as Minister for Health and as Taoiseach, I'm not in any denial about the challenges that people face in our health service, whether it's patients or staff. There are certainly too many patients waiting too long to see a specialist or to get the procedures that they need, and we do have a chronic problem of emergency department overcrowding. But I don't think we should ignore the many very good things about our health service too, and I'm disappointed that you couldn't find even 10 seconds or 20 seconds in your remarks to acknowledge some of the successes of our health service and some of the high-quality health services provided by our healthcare professionals, including our nurses and midwives. We have now in Ireland the longest life expectancy in the European Union. The young people who are here from Ashbourne Community College are likely to live longer than anyone else in the European Union, and that is in part down to the quality of our health service. Real difficulties that people face getting access to it, but real quality and very good patient outcomes once people do. The highest life expectancy in the European Union. That's something we should be proud of having achieved as a nation, and something I'm sorry you weren't able to acknowledge. We have dramatically improving outcomes for patients when it comes to stroke, when it comes to heart attack, when it comes to cancer. Outperforming the NHS, for example, both in Northern Ireland and in Britain, on patient outcomes, and doing so by quite a distance. And we are now seeing waiting times fall. In the Sonja Care report, we set out very clearly that nobody should wait more than 10 to 12 weeks for an operation they need or to see a specialist. A number of patients, it varies from month to month, but the number of patients waiting longer than 10 to 12 weeks has been coming down, whereas in most countries we've seen that going up, and I think that's significant, and we anticipate it'll fall further this year. And we're making real improvements around affordability too, Deputy, particularly when it relates to reducing the cost of medicines, free contraception, expanding GP visit cards, bringing in funding for IVF, for example, this year. So some real changes being made in terms of affordability. And you mentioned the issue of capacity. We have a capacity review. It's been published already, and we're implementing it. So since this government came to office, about 1,000 additional hospital beds have been added to the system, and hundreds of additional community beds as well. And they are needed because of our rising population, our ageing population, and all of the new treatments that are now available to our patients. We have more people working in our public health service than ever was the case before, and that includes about 6,000 more doctors, nurses and midwives since this government came to office. So yes, a very real challenge recruiting and retaining staff, but we're increasing the number of staff that we have, including frontline staff, like doctors, teachers, like doctors, nurses and midwives every year. So that's what the government is doing, and we're continuing to develop and improve on that plan as the years go on.
So Taoiseach, you shouldn't try to hide behind the excellence of healthcare workers to try and deny the failures of your government. I direct my comments to you and your colleagues in government. Yesterday we had 704 people on trolleys. Today we have 712. A survey has revealed that three-quarters of nurses surveyed stated that they considered leaving their posts. You acknowledge that we have huge pressure in the system and massive shortfalls. By the way, the targets that you have set as government for the delivery of beds, you have consistently fallen short in. So you've described the problem, Taoiseach. I'm now asking you to describe your solution, if you would. Can I ask you again to respond to that survey finding, to the very clear low morale and the real pressure that nurses, midwives and others are experiencing in the health service? Can you set out whether or not you are prepared to publish a multi-annual plan for beds, but also for personnel and staff to deliver those beds?